Good afternoon, everybody. It's been lovely to meet you and hear your stories. I'm Laura. I've worked for North Yorkshire Fire and Rescue Service for 8 years now. I'm not operational, so you won't see me flying past in a fire engine. My role is in the prevention team. So anything you see a fire engine responding to, whether that be, I feel very much on topic, people on their bicycles or road traffic collisions, fires in somebody's home or a fire in farmland, somebody in difficulty in the water, a cat stuck up the tree. All of those things we could be responding to on a daily basis. But my team work to try and stop it from happening again in the future. And we do that in a variety of different ways, depending on the subject matter, really. We can't prevent flooding by ourselves, but we can work as kind of part of multi-agency work to decide when new housing is built. We can help communities be more resilient and prepare for flooding. We can identify where road traffic collisions happen or who they happen to. And we can do targeted work with those individuals as well, for example. When we look at water safety, we've got props and equipment that we use regularly in York to demonstrate the power of water and what to do if you get into difficulty in the water. So there's a lot of public engagement to take what we have learnt from responding to emergencies to try and help keep people safe. Because that's what you want. You don't really want the fire engine to arrive and have to rescue you from somewhere. For our work around preventing domestic fires, which is really what I'm going to talk to you about this afternoon, we and every other fire and rescue service in the country offer a free visit to somebody's home so that we can offer really personalised advice to help keep you safe, because everybody lives differently. I can talk generically about some things that will apply to most people, but it's only by being in your home that we can actually see exactly who you are, what your home is like, and some of the behaviours that can make it more or less risky. Those visits are free, and everybody likes something free, and we are a friendly lot. We don't come into your homes to judge anything. We don't mind if you haven't done the washing up that morning. It doesn't make a difference. We are just there to try and help keep you safe and take that learning from why other fires have started to try and make sure it doesn't happen to you. Because sadly, fires still do happen. Over 300 people a year in the UK die in house fires, and many, many more are injured. So we want to prevent that as a whole. So where to begin with fire prevention? I've got my bag of props, and the first thing I'm going to pull out is one of these. So it's really important that your home is fitted with smoke alarms, because although they have never prevented a fire from starting, they give you the best chance of getting out safely. They should be fitted in places like hallways and landings, those places that you would need to walk through in order to get out if there was a fire. There should be one on each level of your home as well. So downstairs and upstairs. One in the middle is not enough. It's not effective enough to give you enough time to get out safely. They should be tested regularly as well. So about once a month. You don't have to climb up on a chair. In fact, I'm saying absolutely don't. But you can use a broom or a duster handle just to push the button in the middle. It will make a noise to tell you that it's working, and then it will stop beeping. And then you can be assured that if there is a fire, this little device is going to give you plenty of warning so you can get out safely. It might be that during the daytime you wear a hearing aid and you take it out when you go to bed. So you might not hear a smoke alarm going off when you're asleep, or you might take medication that makes you drowsy and kind of sleep more solidly. In which case there are different types of alarm available as well. So during one of our visits, we're able to discuss those alarms with you. For some people, having an alarm sounding in the home isn't enough. They may struggle with cognition and not understand what that noise means and what they should do next. So we can also give information about more complex systems that link into telecare. So that's those. Got smoke alarms. In North Yorkshire, we will provide them free of charge to people if they own their own homes. If they live in rented properties, it's the landlord's responsibility to provide alarms, which is why we don't provide them. But yes, lots of free things, which is good. Now, the most common room to have a fire in is the kitchen. Okay, so think of your own homes. Do you have any items like tea towels or kitchen roll or washing, laundry, Tupperware, cereal boxes, an air fryer stored on top of your hob? Because we get called to a lot of fires which start when the hob accidentally gets knocked on, and then the items which have been stored there heat up and can start a fire. So that is an excellent takeaway from today. Keep your hob clear of items at all times. Also try to use appliances like dishwashers or tumble dryers, washing machines during the daytime when you're awake, because if something does go wrong with them, which it can do, you are able to notice it straight away, and it gives you the best chance to get outside safely. Now, I don't know you all that well, but a lot of homes that we visit have got candles. Excuse my wonky candle, it's got warm in the car and begun to kind of melt and gone a funny shape. They are mini fires in their own right, and we do see fires started with candles that accidentally get too close to material, for example, or blown onto soft furnishings and cushions. So it's much safer not to have candles being used at home. But if you are going to, make sure they're on a sturdy surface away from the curtains, for example, and away from pets as well. There's nothing like a cat being curious and jumping up where it shouldn't, or having its tail raised as it walks along a table and knocking the candle off. So I'm just going through some of the common reasons why we get called to fires, so you can think about your own home and try and prevent it from happening to you. If you have any cube adapters at home, which are really common to find in people's homes, and you can still buy them from all sorts of shops, you can put one thing in the top and various ones in the side. It's really easy to overload these plug sockets. And if you're using high energy appliances, the pins inside can get very hot and the plastic can begin to melt. And again, we see fires started because of these and overloading. Sometimes they're missing the fuses inside. We see ones that are damaged, like this one's got a crack in the bottom. And also they might be used for things like irons or hoovers. So they get pulled around quite a lot and then they don't sit flat against the wall. So electricity's jumping. So if you have any of these at home, I would recommend you change them for, if you do need extra plug sockets, a long flat extension. With these ones, you can spread things out side by side so the pins don't come into such close contact. They're not faultless though. It's still very easy to overload them, particularly if you have one plugged into another. And if you're plugging in anything like an electric heater, they should always go straight into the wall sockets because of the amount of energy they use as well. This one is a terrible example because one of the things has been snapped off inside. We have got another display one where the cable is also damaged. So have a little bit of a check as well with the ones that you use. Now, on Sue's theme of electrical tech. Okay, we've got more and more of it in our homes, whether that be mobile phones and chargers, iPads, laptops, e-bikes, scooters, for example. And these all contain lithium batteries, which we're seeing more and more instances of fires started because of these batteries overheating. When you are charging something, it's best to charge it again during the daytime when you're awake, because that way, if something goes wrong, you can get out safely. If you start to notice it's getting really hot when it's charging, that's a sign to have it looked at or replaced. And try to charge things on a hard surface like a table. We go to a lot of homes and we see phones charging between the cushions on the sofa or maybe under a pillow on the bed. And they just get too hot. So you're not helping that battery cool down. This is a terrible example of a charging cable. So it's had a tough life. It's been pushed in and pulled out and pushed in. So the kind of cable casing is all damaged. So again, if you have a look at your charging cables, if they look like this, it's much better to get a replacement one and try and get a branded one that is compatible with your phone rather than a cheaper one from a market or somewhere like that. Other things which can start fires are smoking materials. So I don't know if there's anybody listening to this today who is a smoker, but there are safer ways to smoke, which are often outside with a jam jar to put the cigarette in and a little bit of water. Some of the less safe smoking behaviours we see are people who don't use an ashtray, or it's a small ashtray like this that can easily overbalance. People who smoke in bed, and maybe people taking medication that means it's harder for those kind of fine motor skills in their fingers to hold a cigarette, so it might drop on them. And if you are taking any medications or you use skin creams as well, there's a growing amount of research which shows that they can impact fire safety too. So medications might affect your behaviour. It might mean that you start cooking and then you sit down and have a little snooze, or you kind of less able to control your fingers, so you might drop something accidentally that could start a fire. So be mindful of that. And if you use medical oxygen, a fire can start in normal air, but if you're putting more oxygen into the air, that fire will start more easily and burn at a higher temperature too. So whenever we find out from the hospital that somebody is using medical oxygen at home, we always contact them and offer one of our home fire safety visits. What you might not be aware of are skin creams for conditions like eczema or psoriasis, or maybe just to prevent sores from forming if somebody's sitting or lying down for long periods of time. There are lots of different brands available, like Dermabase or Zero Base, even Vaseline and E45, really common creams that are found in lots of people's homes. And they are very beneficial. So it's thinking about the risk in proportion to the rest of the other factors. When they are applied, they're quite oily and greasy. And then you might put, for example, a t-shirt or a dressing gown or bandages on top of those creams, and they soak into the material. That in turn becomes much easier to catch fire. So if you have a gas cooking flame, or you do like candles, or you're putting fuel on a fire, for example, or smoking and lighting that cigarette with a match, it's that combination of naked flames and the creams that have soaked into the material, which can be catastrophic. So it's very much about putting these things in proportion. And if you are using these creams, knowing what the risk is, because quite often they do have the orange rectangle saying that they are flammable on the packaging, but people don't necessarily understand what that means. They might put the tub away from the fireplace and think that that's how you make it safe. But it's much more about clothing and material. And you can make that safer by washing things more often or washing things at a higher temperature. Best of all, removing all of those naked flames, which could pose a risk. So trying to get rid of the candles and maybe have more sandwiches rather than cooking on the gas. Who knows? Whenever we do identify a risk in someone's home, we always do try to provide a kind of a way to reduce that risk. We're not trying to scare people so that you don't go to sleep at night because you're worried. It's all about putting these risks in proportion and seeing if we can reduce them and what we can do to help you plan for the worst. So we always talk through an escape plan with somebody as well, right through from would you hear the smoke alarms if you were asleep? What would you do? How do you get out? When you get to the door, is your key accessible, or have you hidden your key in the kitchen drawer and actually the kitchen is on fire, or you can't remember if you put your key in your coat or whether it's in your bag? All of these everyday simple things, which actually a little hook by the door can be that reminder, actually that's where I've got to put my keys because then I know I can get out safely. Those are some of the things we look for in the visits. So how you heat your home, kitchen risk, any smoking behaviours, any medicines or medical devices that may impact your safety. We look at clutter of items as well, because sometimes if things are building up, it might mean it's difficult to close doors. And if you can't get out in a fire situation, to be able to close the door and keep yourself safe while you're waiting for the fire service to arrive is really important. So yeah, we do look at clutter. And we look at threats as well. So sometimes we get told by the police that somebody's made a threat of arson, and we can go to somebody's home and talk to them about smoke alarms and escape plans and trying to reduce that risk. We find out a lot about people in a very short space of time. We're a very trusted fire service, which is a lovely position to be in. And sometimes, particularly in an emergency, we might be the first contact point that person has had with any other organisations. So with your consent, we're able to put you in touch with other organisations as well. Sometimes that's not necessary. Sometimes you're getting all the support you need, but sometimes it can be a referral or signposting to the local council services like adult social care or warm and well teams, or it could be support to stop smoking, or I think who other things we put them in, dementia forward as well. We work a lot with other organisations in the area to try and give a really holistic piece of support to people living in their homes. I would say for AWOCs, it's particularly relevant as well. You want to do everything you can to make your homes as safe as possible. And somebody coming in and testing your smoke alarms and making sure they're working is something off your mental load as well. It's one thing you can tick off that list, and know that you're safer for that. So now you know about the home fire safety visits that each and every fire and rescue service offer. The best way to contact your local fire and rescue service is to search online for their website, and it will take you through to a link. In North Yorkshire, we also have a telephone number that people are able to call. So it's that recognition that not everybody likes to do things online. For people in the room, I have got a little form that I can complete today for you if you would like one of these visits. And I will ask Sue to distribute our contact details as well with anything that goes out afterwards. Okay, so in North Yorkshire, the phone number to ring is 01609 780 150. And that takes you through to our reception line, where somebody will ask a series of questions. Now, those questions are just designed for us to know who we need to visit in priority order. Our website address is www.northyorksfire.gov.uk, and you can follow the tab that says book a home fire safety visit.